Beta-1 agonists are sympathomimetics, meaning they stimulate a sympathetic nervous system or fight-or-flight response. They bind to beta-1 receptors, which are primarily located in the heart. When they bind to these receptors, they have a positive chronotropic and inotropic effect. This means that they increase the heart's rate and force of contractility, causing an increase in cardiac output, or the amount of blood the heart pumps in 1 minute. The most common beta-1 agonist is DOBUTamine, administered as a continuous intravenous infusion. The medication is titrated to achieve the desired response, indicated by the MRP. This could be the heart rate, blood pressure, urine output, central venous pressure, pulmonary capillary wedge pressure, or cardiac index. Beta-1 agonists are most commonly used short-term in an intensive care area to treat cardiac decompensation, such as after cardiac surgery, cardiogenic shock, severe heart failure, and cardiac stress tests. The most common adverse effects of beta-1 agonists are hypertension, dysrhythmias such as tachycardia and premature ventricular contractions, and chest pain. Chest pain should be reported to the MRP. Beta-1 agonists should be used cautiously with tachydysrhythmias, such as atrial fibrillation, ventricular ectopic activity, and hypertension. Monitoring heart rate and rhythm using bedside telemetry, blood pressure, and urine output during beta-1 agonist therapy is essential. Pulmonary capillary wedge pressure, cardiac index, and central venous pressure monitoring may also be required. Regular blood work to monitor potassium levels is also important, as hypokalemia may occur. Before starting beta-1 agonist therapy, hypovolemia or low fluid volume should be corrected. And finally, it's important not to confuse DOBUTamine with dopamine. I hope you found this video useful. If you did, please let me know by giving it a thumbs up, subscribing, and leaving a comment below. Thank you, and bye!